Yes.
Okay. All right. Hi, my name is Jen Carter, and I am a member of the steering committee of the Virginia COVID-19 Justice Coalition. And first of all, I want to thank everyone for being here today to talk about how the issues during COVID-19 have affected people behind bars and how we can use what has happened to inform legislative solutions going forward. I am also co-founder of the Humanization Project. We work to humanize people behind bars in the eyes of the general public to help drive criminal justice reform. Daily, I speak with and hear from people behind bars. We want to begin this town hall by reading a letter from a group of men at State Farm Enterprise Unit who have formed an organization called Point. Some of them are very well educated, some are self-educated, but they come together to teach and learn with each other, holding talks on everything from history and how our legislature works to how to be a good person and how to treat the environment, and things like how to disagree without getting into a fight. I'm continually impressed with all of them and so happy that you can hear their voices directly right now. I know it is a little long, but when behind bars, it can seem your voice is never heard. So when they learned that we would listen today, they understandably had a bit to say. I'm going to pause for a moment and just to remind everyone that's on the Zoom call, you can mute yourself. Just so you don't have any.
It's a COVID-19 coalition that we joined with VACDL.
So I'm going to go ahead and read the letter from the guys at Point up at State Farm Enterprise Unit. We wish to start by thanking you for participating in this town hall and for genuinely listening. Real progress requires that those with the greatest power humble themselves to listen and understand the concerns that plague those most impacted by their policies. We hope this will be the beginning of a true dialogue, enlightening and empowering in both directions. We will gladly devote ourselves to real cooperation if you care to follow up. We wish to thank the coalition and all members of the legislature, the media and the public, especially our families who have expressed deep concern about our well-being during this pandemic. When things first became widespread, we were heartened to see more attention than we typically receive. We were all very hopeful after the budget amendment and some initial safety measures seemed that they would help. We truly believe that many involved had tremendous intentions and that a number of beneficial policies and procedures were promoted. We are thankful. But as things progress, the reality on the ground has fallen far short of these noble intentions. The safety procedures have been only conveniently applied, typically when it serves to control and limit us, but not when to our benefit, and so few people have been released. It has been uniquely challenging and varied behind these walls, where we are widely voiceless, cannot socially distance, and have no control. In order for you to understand fully how this situation has impacted people behind bars, you must hear the individual issues we have experienced, hearing us as people, not one-dimensional, quote, criminals. We have hopes, fears, conditions, skills, and families, just like you. My name is Harry A. Trainum. My family calls me Antoine, and after 20-some years of being in these prisons, my family is all I have left. They are what pulls me through, and what gives me hope and strength to face each day. And they are my encouragement when it seems that everything says to give up. Now, COVID-19 causes me to worry daily about them and losing them. Truthfully, I just want a chance to be there for them. On the other side of the coin, they also worry about my untimely demise due to COVID-19. We are just hoping for a second chance to be together again. My name is Sean Howell. I was recently quarantined in solitary confinement because I had to be taken on a non-COVID related medical run. The conditions in the hole were so filthy that I became sick. I am feeling better now, but I can't help but worry about this pandemic and how it's being handled here. I fear I will not survive long enough to see my family again and vice versa. My name is Taj Manhaft. My teenage son is anxious and struggling with online earning and isolation. My fiance's business has been devastated by social distancing. My perennially hurting mother is afraid to go out for groceries. I'm a teacher, a dedicated worker, a healthy son, wanting nothing more than to help them. No victim or complainant in my case, having already served way past the guidelines with no infractions behind bars, only time spent educating, writing, learning, and starting a nonprofit. But I can't even be considered, just left helpless to help. even as DOC itself calls me the lowest possible risk. What good does this do anyone? My name is Robert Martinez. I lost two of the most important people in my life. My sister, Anna Martinez, was 58 years young, and she died on April 2nd. A week later, my mom, Dulce Martinez, who was a beautiful 89 years old, died also. Both died as a result of COVID-19. They were residents of New Jersey, and their deaths made life seem just as far away. It has been unbearable dealing with their deaths under these circumstances, especially when there is no healthy outlet for me to mourn them. Knowing that I was only 30 months from seeing them again makes the weight of their death that much harder to carry. The constant stress of dealing with this prison environment and the loss of my family is a pain I am forced to carry every day. Existing measures have failed to protect us fully. The rate of infection is much higher behind bars than the general population. We have been consistently left in the dark, not even given our own test results or told what will happen next. We have missed funerals and final goodbyes with our loved ones. We have been made more helpless as they struggle. We have been threatened with 14 days in the red zone with positive cases as quarantine if we choose to go to necessary medical treatments for things like diabetes and cancer. We have been threatened and punished, losing good time for wearing actual N95 masks rather than the ineffective constrictive ones we have been given for our safety. Not a day has been missed demanding we work for microscopic wages at non-essential jobs with untested outside employees so millions can be made by private industry, even as our religious programs, education, law library, and visits have been canceled indefinitely for our safety. Almost no one was released, even after you promised. The state prison population remains above 29,000, making every facility a breeding ground for infection. Clearly, DOC's discretion on release is not to be trusted, as they approved only 10% of those with already below a year remaining. Likewise, the parole and conditional pardon process was insufficient to make a difference. It was genuinely expedited and more releases granted than usual, for which we are thankful, but it was still a numerical drop in the bucket. Meanwhile, it was repeatedly attacked publicly against all evidence with only fear-mongering rhetoric and no strong retort or humanizing account. Of course, victims should have a voice, but after decades, not the only one. How could somebody not be entirely different after 40 years behind bars? Clearly, the response to the virus behind these walls has fallen short of what you intended and what we deserve. We thank you, but we ask you look in your hearts and do more, please. What has been done towards safety is better than nothing, certainly, but has been inconsistent. Imagine if it were your brother or son stuck here, powerless, and act accordingly. And who is locked up here? Fathers, brothers, sons, and husbands, mothers, sisters, wives, and daughters. Crime risk, especially violence, diminishes precipitously by age 35, yet Virginia has the oldest prison populations. Expensive, pointless, and only breaking up families. Plus, this state has imprisoned people of color at the same disproportionate rates as Minneapolis uses force. So the people discarded and left to age in sardine pandemic conditions, our families and communities without fathers, sons, and brothers are predominantly African American. Families separated young and kept apart for generations. Is this acceptable ever? Will you really let it stand right now? We implore you and all your colleagues, see us as human beings, equals. In terms of the ongoing pandemic, make safety a top priority, even when inconvenient and politically bold. We ask for greater transparency, accountability, communication, and the quick release of everyone who has demonstrated low risk, as evident in their behavior, rehabilitation commitment, and character in recent years, as well as all individuals over 60 and those suffering chronic severe health problems. Reduce the prison population enough to allow social distancing in all facilities, using community oversight to allow us to contribute and survive. Offer us a voice in safety planning moving forward and an external outlet for concerns. Apply appropriate restrictions consistently and prioritize the return of some form of programming, services, and visitation based upon a predetermined set of testing guidelines. We should not be put at risk for profits, but denied our faith and family. Install independent oversight with public reporting mandatory. Beyond responding to the virus, we call on you to promote evidence-based practices at all levels of the criminal justice system, relying on data instead of dog whistles. Wherever discriminatory outcomes exist, alter the system fundamentally. Treat each violation of the law as it is, an error made, sometimes terrible, by a human being who can and will become a better citizen if given hope, purpose, and resources. Please take bold steps to lead us in a new direction where incarceration is a last resort, minimized to reduce the human costs and improve public safety. Create a permanent, widely accessible system whereby anyone who has erred can earn the chance to be treated as fully human again. A release valve available to help whenever the system is shown to suddenly need change drastically. Treat us as partners in public safety and building a better Virginia, not trash to be tossed away and forgotten. During the virus, we have seen the best intentions and devotion to real principles filtered through self-interest, regressive policy, and dehumanization, leaving our lives and families shadowed in indifference. Never before has public opinion and need coalesced to demand and permit fundamental change of a criminal justice system built by defeated slaveholders to maintain control and power. Won't you please be your best selves, stepping up to demand and enact real progress? Don't farm it out or leave it up to others' discretion. Don't pass the buck or take baby steps anymore. Be the change you claim you want to see and personally stand at the vanguard of evidence, equity, and humanity. Act for your legacy and the future of all our citizens, not with concern for your next election. Forever live the boldly principled. Thank you all for listening to these strong voices. And now I would like to introduce our moderator for the evening, Kim Rolla of the Legal Aid Justice Center. Kim is the interim director of the Legal Aid Justice Center's Civil Rights and Racial Justice Program. In their original role as housing team coordinator, they witnessed the brutality with which racism and poverty continue to shape the contours of neighborhoods and impact the lives within them, while also witnessing the strength of organized communities and the power of naming and attacking the root of the systems that harm their clients. Now, on the Civil Rights and Racial Justice Program, they develop campaigns to combat the criminalization of the poor, people of color, and far too many Virginians. Thank you, Kim.
Well, thank you, Jen, and thank you to the members of Point for starting our event with words directly from people who are experiencing the harms that we're going to be discussing tonight. As I'm sure many of you know, the isolation of being behind bars means that it's frequently hard for folks' voices to be directly in these conversations, and the lockdowns around COVID-19 and the difficulty of communicating with people in prisons and jails and all carceral facilities have made that even more severe. So just thank you, Jen, for sharing those words with us to start our event tonight. So just to remind folks what we're here to discuss, this is the second in the Virginia COVID-19 Justice Coalition series of town halls, and tonight we're hoping to discuss legislative solutions to the COVID-19 crisis in our detention system here in Virginia, broadly defined, which we'll talk more about. And I just want to, for folks who are not familiar with our coalition, we've come together over 50 organizations across Virginia to respond to the pandemic in our detention system, and have really come together around 3 core demands. And those demands are for the state of Virginia and localities to release anyone in custody who does not pose a demonstrable imminent threat of bodily harm to someone else, to release those people as soon as possible, and for the statewide and local decision makers to hold themselves accountable and share information about the pandemic in these detention facilities publicly. So the way that we're envisioning this conversation going this evening is we have an incredible panel. Just to briefly, Matteo Gasparotto from the ACLU, an investigator with the ACLU of Virginia, Senator Bill Stanley, Tram Nguyen, who's a co-executive director of New Virginia Majority, and Senator Jennifer McClellan. I'm going to introduce each of them with just a paragraph slice of the wonderful things that each of them do, and then give them about 5 minutes to tell you themselves how they think about the question that I just posed about legislative solutions, focusing on legislative solutions, but how we address the COVID-19 crisis in detention systems in Virginia, and let them kind of start with their own frame, and then we'll take about 20, 25 minutes to pose some questions to the panel, have a discussion with just the 4 panelists, and then we're going to open it up after that for about 15 minutes to have coalition members themselves pose questions to the panelists, because we have a lot of people who do incredible work and bring incredible knowledge to the coalition, and we want them to be able to interact with our panelists directly. So if you have questions, feel free to put them in the chat pod. We'll be looking for Gary will be, as he's demoing, put your questions here. And we'll be monitoring that and creating kind of a queue for folks as the evening goes. But without further ado, I'm going to start with introducing Senator Jennifer McClellan, who was elected to the Senate of Virginia in 2017 after serving 11 years in our House of Delegates. She has been a leader on improving education, breaking the school to prison pipeline, criminal justice reform, expanding access to affordable housing and healthcare, combating domestic and sexual violence, diversifying Virginia's economy, civil rights, and ethics reform. Senator McClellan is also the chair of the Virginia Dr. Martin Luther King Jr. Memorial Commission, where she works to promote Dr. King's legacy and continue his work, particularly racial, economic, and social justice and community engagement. And she lives right here in Richmond, Virginia, where I am, with her husband, Dave, and 2 children. So with that, I'm gonna invite Senator McClellan to tell us a bit about how she's thinking about the issues that brought us together tonight.
Well, thank you, Kim, and I want to echo your thanks to Jen for reading the letters from the gentleman incarcerated, living in the midst of this crisis. And I couldn't help but think, as I was listening, someone said to me the other day that the people closest to the pain need to be a part of the solution. And we can't hear their voices without them being amplified, and we know that. Even though I have a number of constituents who have loved ones who are incarcerated, and I do hear from them. I hear from a number of people from across the state, but I know those are just a drop in the bucket. And so I want to thank all of the organizations on the panel today. And in the coalition for helping amplify these voices, not just in the middle of the COVID crisis, but you have been doing it for as long as I can remember. And I want to just say thank you for that. I think there's some things we had already begun to work on over the past few years and made quite a bit of progress on this year that I think the need for has been heightened. First, I think we know already that over 40% of the people in our jails right now are being held pre-trial. They've not been found guilty of anything. And with jury trials suspended, many are just being warehoused in our jails, and that is not humane, that is not safe. And that is a problem. And we were able to make some progress just quantifying that and getting some transparency around the use of pretrial services. We had a bill passed this year that will require some data that will be presented to the General Assembly for us to act on in January. I wish we could have gotten it sooner, but we didn't foresee this crisis coming. But as soon as we get that data, we will begin to do work to address pretrial services and the much too large number of people who are being held who have never been found guilty of a crime. I think, so that's one specific thing we are looking at, but I can't help but echo what one of the gentlemen said. Look at us as human beings and as individuals and not just a collective of people who are incarcerated. Unfortunately, for way too long, our criminal justice system has not looked at them as individuals. They've looked at them as the crime they were convicted of, even if in some cases that might not be the crime they committed. they don't look at who that person is today. I see it time and time again, having been elected after parole was abolished, hearing stories after story after story of people who have been in jail or in prison for decades, who are not the same person that they were, who in many cases pled guilty to their crimes because they were charged with something else and were afraid that they weren't going to have true equal justice applied to them. And we've made some progress on that this year with legislation to require recording of custodial investigations, because we've seen a large number of people who confessed to crimes they didn't commit and were proven innocent later. And so I think what we need to do is begin to shift our system into one that looks at rehabilitation. Well, first looks at prevention and gets at the root causes of crime so that we don't need to incarcerate anyone. But look at rehabilitation and reentry and giving prisoners the tools they need to successfully reenter society and give them a chance to successfully reenter society. And I think we all of us on this panel have been committed to doing that. There is a fierce urgency of now that we have to do that. I can't be here and not talk about the civil unrest that is going on, which we've seen before. We saw it in the 90s when I was in law school with the LA riots. We saw it in the 60s where the Kerner Commission told us, here are the root causes of this civil unrest and these riots and what is leading to a sense of hopelessness that explodes in the streets. We didn't do anything about it. But now something's different, because now a lot of people who either didn't see the inequity in all of our systems, but particularly the criminal justice system, who either didn't want to see it, couldn't see it, can't ignore it now. Can't ignore it. And what I see and what I have is hope that a lot of people across generations, across races, across ideology, after seeing a man murdered on video, have said enough, have said, I cannot ignore it anymore. People who have had their eyes open and said, we can't just go on with our daily lives. And they're committed to change. And I think they're going to demand change and help give the political courage and the political will to do exactly what we heard a man cry out for, and that is be compassionate and do what is right, even if it may not on its face be politically popular. But right now, I think there are a lot of people who see the need and are gonna demand that change. And I think we're here to listen. We're here to make that change. But to make that change effectively, we need to hear from the men and women who are incarcerated and living this pain every single day, and gonna do that and solve finally.
Thank you, Senator McClellan. I think I really appreciate your comments connecting COVID-19 to broader criminal legal system reform efforts. And I know that a lot of the coalition members want to talk about that, as well as the comments you made connecting this to the uprisings that we're seeing across the country. And I know we're really interested to hear about how you all think about this as related to conversations around policing as well, since these are really, just different points in the same system. So I'm going to turn now to Senator Stanley to introduce him and give him a moment to talk with you. So Senator Stanley, throughout his 20-year legal career, has built a strong trial practice throughout the Commonwealth of Virginia. He's focused on personal injury, criminal defense, representing small businesses and individuals in litigation matters, including construction disputes, land use, contract matters, commercial litigation matters, and mineral rights. Senator Stanley has successfully argued cases before the Court of Appeals of Virginia, as well as the Virginia Supreme Court, and he has been a member of the Senate since 2011. He currently serves on the Agriculture, Conservation and Natural Resources, Judiciary, and Local Government Committees. He represents the 20th State Senate District, which includes Galax County, Martinsville City, Patrick County, Henry County, and parts of Carroll, Franklin, Halifax, and Pittsylvania counties, as well as part of Danville City. And though it's not in his description, he's also been a champion of criminal legal system reform in the GA. So we are grateful to have him with us. And with that, I will let Senator Stanley take it away.
Thank you so much. And thank everybody who's here, and especially thank the Virginia COVID-19 Justice Coalition for having this very important meeting as we're having now with the pandemic. It's unfortunate that we cannot be in person because I think there's a lot better ability to have some interaction and honest discussions, but I'm now getting used to these Zoom teleconferences. And so hopefully I can communicate to you from the other side of the aisle that this is not a Republican or Democrat issue, that this is a criminal justice reform issue. And that from my perspective, that as a Republican from the southern part of Virginia, that it is as important to me as I think anyone else, that we do what that person said in that letter that you read, that we see those who are incarcerated as human beings. For 26 years, I've been a lawyer, and I've seen justice go well, and I've seen justice denied. I've seen the criminal justice system work for someone, and I've seen it work against them. And it has always instilled in my life, as every year passes, a greater desire to fix the system as best as we can. It is not a perfect system. I don't know that we could ever get to a perfect criminal justice system, but it is up to those persons that go into those courtrooms every day, and whether it be for those clients who cannot afford to pay when you're on a court-appointed list, or those that you represent, whether they pay you or not. The criminal justice system works when there are those that throw themselves against the gate and make sure that the government is held account, that the government is held to that standard, that the police officer is held to that standard, that the prosecutor is held to that standard. And I've tried to live my life that way. My father, I came to him when I was a younger man and said, Dad, I figured out that you can't change the world. And my father, who died the month after I graduated from college, said to me, son, if you can change the life of one person, then you've changed their world. And if you've changed their world, then you've changed the world. And I've always lived by that in terms of my practice. The great majority of my practice, and I appreciate you reading all the things that I do, is criminal defense. It's the thing that I enjoy the most, but it's the thing I think that is most important in a profession which gets, as Senator McClellan could probably agree with me, as a fellow lawyer, we get a lot of jokes, we get a lot of disdain, but quite frankly, it's the one thing that stands, as William Shakespeare said, between us and the government, the people and the government. And so it's a very important undertaking that I take very seriously. I'm reminded, especially when we talk about criminal justice reform, as it starts in the prison wall and moves backwards, and I think Senator McClellan hit on this very well. I'm reminded about how many people enter that system, even by plea bargain, who are not guilty of the crime that they committed. Now, I am reminded that sometimes that the tools that we think we should have to fight the government are not there, and that the government has all of the tools. And so it is an uphill battle for many people who are brought before the bar of justice who are accused of a crime. And I've seen too often in 26 years, those people who have been accused of a crime that they did not commit, but because they lack the resources, not certainly through my office, but I've seen it in other ways, that they could not fight the justice system. They could not fight the government. And that has been a major problem in my life. And I struggle with that every day. And that's why whether I'm court appointed or whether someone hires me, I give them the same defense as I would to the person that came in with a large check, because we owe it to them. When we talk about criminal justice in the prison, I'm reminded of a client of mine who I inherited from an old boss of mine from Northern Virginia, another Republican, who was fighting for this gentleman who had been charged as a young man being the driver. He was addicted to drugs of a group of people that drove to 3 counties, committed burglaries or breaking, entering, or stole property, fenced it, used it to support their habit. In the end, because of bad probably representation, he was then in those counties convicted and then ended up getting a 48-year sentence for prison, in prison. And in Buckingham, and quite frankly, was a model prisoner, somebody I got to know over time, talked a lot to, I've grown to know and love his family, and I could see the difference in him. Someone had just earlier said that the differences, and I think it was Senator McClellan, of when you go in and when you come out. That's what the criminal justice system is supposed to be about: rehabilitation, and then coming out with a clean slate because you paid your debt to society. Ray had certainly done that. I won't use his name, but I just did. And he's somebody that I adore. And here he was suffering from cancer. And I was trying to get him a clemency petition from the previous governor, who denied it on the last day that he left office. But the COVID-19 pandemic, I refiled it in the period of time which I could make a refiling. And I must credit Governor Ralph Northam's staff and our Secretary of the Commonwealth, who then expedited that petition. And now my client is a free man, back with his mother, rehabilitated and free. And so I saw both where the justice system does not work and in the end where it can work, and for the benefit of someone. I always wonder to myself now, because he thinks I'm great and I did a great job, but would I have gotten that benefit? Would he have gotten that benefit if the COVID-19 pandemic was not there? And that should not be the question. The question should be somebody who was sentenced to 48 years, who had served 30 years of that sentence, suffering from a debilitating condition, even a life-threatening condition, should not be given then the humanity that we all profess to have and possess to own when it comes to making sure that his life, his health is not in jeopardy because of the condition he's put in by this government. When you talk about the issues of the COVID-19 pandemic as it pertains to our self-contained Department of Correction units, it is obvious from your letters that you were reading and the words of those that sit in prison right now, that what this state is doing is not enough, that what we're doing is lacking of even the most basic humanity. And that breaks my heart. I wrote so many notes here and that I'm going to carry with me rather than us talk about it. But I think then we should redouble our efforts to do more to make sure that we do see them as human beings, as was stated, and that we do more to protect them as a group of people just as vulnerable as those that may be in nursing homes sometimes, because we know that those kind of diseases can spread very quickly in the prison system. I'm reminded for 11 years I've fought for criminal justice reform, much to a deaf ear, as Senator McClellan can probably agree with me on, until most recently. But we were able to get some serious pieces of legislation passed. One of the ones I'm thinking about was Senate Bill 124 in 2016, which for the first time required DOC, and this was a bill that I offered, and it was from a client of mine who had been in prison for a while, and he was coming out, but he was coming out with no skills. And so what we created was the prison reentry program, which then not only helps in education, but also resume building, making sure that they're up to date on the current technology. One of my clients at the time went in without cell phones, came out and had smartphones and all this technology, and was completely overwhelmed. Even personal banking, personal finance, doing the things and giving them the skills that will give them as much of a chance to be successful human beings on the outside. And so we were very proud of that piece of legislation. We've seen a lot of results from it. But that's just one piece, whether it's weekend jail time that I fought for 5 years, or with one of my great friends, Amy Woolard, who I think you all will agree with me is one of the greatest people in the Commonwealth of Virginia. We worked for 5 years, not to get people out, but to prevent them from going in with Senate Bill 1, which is finally passed. And I had one of the greatest chief co-patrons that a person could ever have on a bill. And I'm looking at her right now, Senator McClellan. I'm very proud to have carried that with her. But we were stopping what was becoming debtor's prison for those that could not afford to pay fines and costs assessed, not just by the court, but by this General Assembly, taxes. And that because they were trying to feed their family, go to the grocery store, get gas, or go to their job, they were getting arrested over and over again. And now they were in prison or in jail. And now they are wards of the state and not being successful human beings. We were able to knock that out this year. And I think one of the most historic pieces of legislation we had. So when we talk about prison reform and criminal justice reform, not only should we think about what we can do for the people and those men and women that are in prison and help to make sure that when they pay their debt to society, that when they come out, we as a community embrace them and give them every opportunity to succeed and have the American dream as it should be, because we're a land of second chances. But also to be reasonable, Do not categorize people who come before the bar of justice because they may not be rich enough to pay the tax or the speeding ticket. That we are compassionate in what we do to encourage them so that they have ultimately a positive encounter with the criminal court system. So that encourages them, as I do, walking them out the door every day saying, please don't come back here. Let's learn from this. Let's make it better. Let's make our lives better. And I think the government can play a very active role in that. So I'm very glad to be a part of this panel. I had Richard Krause, my legislative aide, pull all the legislative bills from the very beginning when I started in the Senate in 2011. And they're sitting around me right now. And there were 17 bills that I proposed. 9 have been passed. And I've just realized now that I think Senator McClellan and I need to file a bunch of these next year as well. So, but I'm with you on this, and let's do what we can. We have to balance justice with mercy. And I think we can get there. But it's not a singular issue of one party or of one thought process. It is something, as we did with Amy Woolard and myself did with SB1 and Jen McClellan did, that ending of license suspensions for those who merely could not pay their fines was as much a conservative issue as it was a liberal issue. It was much as a Republican issue as it was a Democrat issue, because ultimately what we're talking about here today is a human issue. And that's what we need to focus on. So thank you for letting me be here.
Thank you, Senator Stanley, and congratulations to you and your client on the clemency petition. And we're really grateful to have you both as a senator and a criminal defense practitioner on the panel with us tonight. So thank you again. And I'm going to turn now to Matteo Gasparato, who I think is still with us and just has his camera turned off. There he is. So Matteo is an activist and an investigator with the ACLU of Virginia, where he works with the legal and advocacy teams through data gathering and analysis, research, and community outreach. Working with community members and leaders, he seeks to root the work of the ACLU in the community and elevate the voices of impacted community members. A great deal of the work that Mr. Gasparato has done in his 3 years in the ACLU has been in jails and prisons around the Commonwealth, where he works with incarcerated persons in the interest of protecting their civil liberties and expanding accountability for correctional facilities. He has done work around ending solitary confinement and worked extensively on the Reyes case, where an immigrant had been held in solitary confinement for over 13 years because he doesn't speak English. So with that, I'd like to invite Matteo to give us some words about how he's thinking about the realities of COVID-19 in jails and prisons and what he's hoping to see from the legislature to address this.
Cool. Thanks, Kim. I also want to thank all of my co-panelists and everyone for joining us this evening. I really hope this conversation can drive our efforts forward to protect people who are incarcerated, to protect them from COVID-19 and provide some context for some of the issues around the conditions of their confinement. In my years at the ACLU, my colleagues and I have worked hard to advance criminal legal reform in the Commonwealth, as have all of the dedicated members of our coalition. That work has taken me to communities and places that I'll always be grateful to have been able to connect with. A huge part of my role as an investigator is to bring the voices of people impacted by these issues, not only to the members of our staff and to our legal teams, but to the public at large. It's taken me to the belly of the beast, Red Onion State Prison, and into long, intimate conversations with family members of people who are incarcerated, and often those people themselves. More often than not, there are things that don't make it into my memos to the team, such as the pain of their isolation, their concern for a loved one who isn't receiving medical care, the fear of the unknown when they're staring into the abyss of the correctional system. I recently spoke to an immunocompromised gentleman who's being held indefinitely in jail until he can pay a civil debt off. He approached his circumstances with a bit of gallows humor, but there's no mistaking the fear in his voice when we were discussing how COVID could impact him. Many of the people that I've spoken to are being held pre-trial and they haven't been convicted of anything, but the virus has disrupted the courts in such a way that they don't know when they're going to be able to get a hearing or be released. The past several months have been trying for people across Virginia and the world. Communities have been struggling with fear, loss, and isolation that people who were incarcerated and their families faced well before this pandemic. Advocates have been struggling with opaque bureaucratic structures that continue to hide inaction, inflict undue suffering, and evade accountability in the face of an unprecedented public health crisis. In the words of a VDOC staffer, the DOC is playing fast and loose with the health of the inmates by continuing to allow workers to come onto the facility regardless of their symptoms. We've been told about inexplicable, almost arbitrary relocations of infected people into healthy pods, and the movement of people into isolation without privileges, and in some instances without medical care, when they've tested positive or shown symptoms. Loved ones have told us that the inmates are packed into these tiny human warehouses, which makes social distancing impossible. And we've also heard from one mother who said that my son is in prison and has about 15 months left to serve. This is a death sentence for him. We've received hundreds of phone calls and emails from people on both sides of the bars who are vulnerable to this virus, and they're terrified. Throughout this evening's discussion, there's going to be a lot of conversation around accountability and releasing people from custody as soon as possible through various, hopefully readily accessible and transparent means. I really hope that this evening highlights that these aren't abstract ideas. These are vulnerable people and their families are suffering. They're at the risk of contracting a deadly disease unnecessarily because of inadequate efforts on the part of statewide and local decision makers. Another element we can't escape is the racial injustices embedded in the issue that we're facing. People of color are overrepresented in our jails and prisons, and we can't in good conscience say that Black Lives Matter while not addressing the unjust impact that this virus has on these populations behind bars. I hope that we can find a way to align Virginia's jails and prisons with the reality that unless Governor Northam, the Department of Corrections, and statewide and local leaders take quick and decisive action, we've regulated vulnerable Virginians to death, in some instances without a trial. This virus has shown a light on many of the systemic inequalities inherent to our criminal legal system. And now it's a critical moment where we can rebuild trust in our institutions and hopefully emerge from this virus with a more equitable Virginia.
Thank you so much,
thank
Mateo.
Sorry, thanks, Kim.
Yeah, I really just want to thank you also for naming that it's not just policies, not just the letter of the law that we're talking about tonight, but also how that looks on the ground, right? And that's why it's so important for us to have you here on this panel with us to tell us, even when laws are passed and even when policies are implemented, how does that actually look for the human beings that are living the realities or of those policies being implemented or not properly implemented. So thank you, Mateo. We're really glad you were able to join us. And last but certainly not least, we have Tram Nguyen with us, who is an award-winning activist and community leader who helped found New Virginia Majority in 2007. Tram currently serves as New Virginia Majority's co-executive director, where she leads multiracial, multi-issue campaigns using large-scale civic engagement, community organizing, advocacy, leadership development, and strategic communications. Under her leadership, New Virginia Majority has mobilized over 1.5 million Virginians, immigrants, people of color, women, low-income working people, and youth. Her advocacy work on democracy, criminal justice, immigrants' rights, climate change, healthcare access, and economic opportunity all explore the intersections of social, racial, and economic justice. So really grateful to have Tram with us this evening, and I will let her say a few words before we get into our question and answer period.
Thank you, Kim. Thanks for having me. And I want to also thank our fellow panelists for having this really important conversation. As Kim mentioned a little bit about our organization, we work with some of the most vulnerable and underrepresented communities in the Commonwealth of Virginia, including a lot of communities that are frankly getting hammered by this COVID-19 crisis, from the Latinx community that is disproportionately impacted by COVID-19 to the prison population, which is the folks that we are talking about tonight. We organize a lot of returning citizens, folks who are formerly incarcerated, who have stories, right, of their experiences, not only while they're incarcerated, but a lot of loved ones who are still currently in the system. And, I want to thank Jen for, sharing all of those stories at the beginning. We're getting stories every day into our offices and through our organizers as well. A mother whose son, for example, is in the Greenville Center where there have been over 200 positive cases of COVID, and how, her son, she can't always communicate with her son. They have red, yellow, and green zones. They're often on lockdown without a whole lot of information about what's going on. And this is an everyday reality for so many folks, right? And so it's really important that we are trying to address the situation that they're facing right now, and also think about ways to prevent these types of situations in the future. Virginia is a mass incarceration state, let's face it. We have about 1,200 crimes on the books that are counted as felonies. We have over 122,000 people that are currently incarcerated. Many of them are youth, right? And so we have to think about this criminal justice system pretty holistically if we're going to address some of our most vulnerable populations. One of the things we actually just today sent a letter to Secretary Moran, trying to get a little bit more information about the early release program that is that the General Assembly essentially authorized. So as of June 15th, we know that more than 1,300 incarcerated people have tested positive for COVID-19. And we also know that as of June 15th, which is this week, 382 individuals have been released pursuant to that early release program. And so we're trying to get more information about, what is the timeline and process to adjudicate the other folks that are eligible for early release? What's the holdup? When will they be released? What information can we share with the community to essentially handle and address some of the most vulnerable folks that are incarcerated right now? And as we think about reform, right, and I think that's what the conversation tonight is about, as we think about reform of our criminal justice system, or as some folks call our criminal punishment system, I think it's a both and, right? What happens before somebody enters the system? And there's a lot of conversations right now, and we're seeing it out in the streets about, police accountability and transparency and addressing police brutalities. And so what can we do to address some of the laws that we have on the books to prevent people from entering the system to begin with? Can there be an increase in community-based alternatives, for example, to youth and adult incarceration? How are we thinking about those things? Pre-trial services, as Senator McClellan mentioned earlier. I mean, there's so many things that we can address on the front end. And then, on the back end, while folks are incarcerated, how they're being treated. And then can we also increase support for reentry programs, right? Local reentry programs where, people are facilitating the successful transition of our returning citizens back into society to reduce recidivism. I think that is one of the areas that our organization has worked on for a long time. And that's why we have such a robust base of folks who are returning citizens, who really are engaged and active in trying to make the world a better place and to make their communities a better place. And so I think that's what we need to be thinking about is, the both and of our criminal system, and how we can be thinking creatively about legislation to fix a system that, quite frankly, was built to really put a lot of folks, put a lot of folks down. So that's where I would welcome, opportunities to work with folks like Senator Stanley and Senator McClellan as we go into whether the special session or next 2021 session, and with all of the partners in this coalition to just really think about the wraparound reform that we're going to need if we're going to really have a criminal justice system versus a criminal punishment system.
Thank you so much, Tram. And thank you to all the panelists for kind of framing this conversation so well for us. I just want to remind folks that are here with us watching from home, either in the Zoom meeting or on Facebook, please, if you have any questions that you're interested in asking the panelists, go ahead and put them in the chat pod. We're going to take about 15 minutes to have some pre-decided questions posed to the panelists, but then we're going to open it up for you all to really take this conversation where you think it needs to go. So for the first question, I wanted, and I know Senator McClellan may need to leave a bit early, so I wanted to direct the first question to Senator McClellan and Senator Stanley, actually addressing something that Tram just raised, the budget amendment that passed in April to temporarily expand the Virginia Department of Corrections early release authority. As Tram mentioned, I think as of today, 388 individuals have been released under that early release authority. But that's of about 29,000 people that are in our prison system. So my question to both of you is, did you support this expansion of VDOC's early release authority for people who are within a year of their release date? Do you think that's sufficient to address the acute crisis that we're seeing in VDOC right now? Tram also mentioned the 1,300 positive tests, 9 individuals have died. And if you do not think that that's sufficient or that other types of action are needed, what do you think that the legislature or state actors should be doing to protect people that are in VDOC right now with the outbreaks that we've seen?
So I will start, and unfortunately I will have to hop off pretty soon, but Moran Wood from my office is going to stay on so that if there are any action items from the questions and the rest of the conversation, we'll have them in my office. I did support that budget amendment. I think I actually presented it on the Senate floor via the Science Museum at the veto session. I don't think that's adequate. And I think part of what we need to do is really dig into the reasons why early release has been so slow. I do know part of the issue may be, and again, we still need some more information on this, is that the parole board works very diligently, and we actually have a parole board now and a chair who believes in parole, which for many years we didn't. But they work very diligently to make sure that anyone who is released has a home plan and has the support structures in place to make sure they can succeed. I also know that for many years, they were understaffed, the parole board and their investigative units. And so one of the questions I want to ask is how much of this is just a workload issue? Because that's a very different fix than if it's a will issue, or if it's they don't have the support system in place when they get out. Each of those will require a different fix. And so first, I think we need to get more information about why it is that we haven't had more release. And then, if you will indulge me, I just want to say something before I jump off. I cannot emphasize enough how important criminal justice reform and dealing with the COVID crisis has to look at the causes of crime and the root causes of crime. So a very quick story. Last year, I went out to the Central Virginia Correctional Unit 13 and met with a group of women and just asked them the question, what brought you here? What led you here? A majority of the women that answered that question, what led them to commit the crime or be convicted of the crime that they were there for was a lack of mental health services that caused them to self-medicate, or in some cases caused them to act out. In one case, it was a compulsion to steal. We cannot address criminal justice reform if we're not willing to address the root causes of crime. And one of the root causes of crime is that too often we use law enforcement and our criminal justice system as a first responder to mental health crisis, as a first responder to mental health issues. If we're not willing to admit that, if we're not willing to address that, we're never going to really make an issue. And then finally, I want to reiterate something I've heard a couple of times, and we definitely hear a lot out in the protest. We need to create, strengthen, and in the case of the Department of Corrections, restore civilian oversight over the system. The Board of Corrections doesn't have true oversight over what's happening in the Department of Corrections. The military, this country was founded on the principle that the military would have civilian oversight. Every other agency and function of government has civilian oversight, except for police and the Department of Corrections and other aspects of law enforcement. That needs to be part of the problem, because that's part of figuring out what's going on and how we hold people accountable and have transparency for what's happening in our prisons, so that we don't have to rely on people like Mateo to go in and collect these stories and bring them out. These stories would come out organically. And so I wanted to be sure to say that before I jumped off and I have another commitment. But I just want to thank you all for convening this very important conversation. And I look forward to continuing to be a part of it through Marin tonight and in the future.
Thank you so much for being with us, Senator McClellan, and we'll make sure that any of those questions that end up in the chat pod get to you. So thank you for joining us. And then Senator Stanley, I don't know if you wanted to build on that in any way. You mentioned your personal advocacy on behalf of a client who you believe should be released in response to COVID. What did you think about the budget amendment that was proposed and the release mechanisms that are currently available? Are those adequate?
So, and thank you for the question. I was one of 2 Republicans who supported the measure. So, and I supported the measure, and of course it was in the nonviolent and limitations of time. And I think, quite frankly, our Secretary of Public Safety and the governor could have done more. And I don't know if anybody, and this was by reconvene, so we knew where we were. When we left the General Assembly in March, before we came back to reconvene, we knew that there might be a problem, but we did not know the extent of it. It was wise of the governor to send down a budget amendment that would empower that branch to be able to, in systems of strain and when there might have been an issue with regard to the pandemic or a hot spot in the spread of it in our prisons, to really address this problem, to relieve the burden upon those that are really 12 months or less ready to get on with their lives and have paid their debt to society. There could have been more. We could have done more. I don't know if, hindsight is always 20/20. So sometimes when we politicians are critical of something, we can do it by saying you did this, but you could have done something else. It has not helped as many as I thought it would. I thought it would have been much more of a release valve than it was and turned out to be. And I have even, we just had one of these matters right now where I went back, and today, as a matter of fact, I had 5 court cases. This is my indigent defense docket today, and was able to talk the judge into a release of one of our prisoners who had completed a program, but now we were in a probationary status, and the judge said, okay, you did what I asked you to do. You finished CCAP. Let's try to get you released. But even the prison system said, well, judge, we're going to have to wait for the order. And by the time we get that done, he'll be ready to be released next Friday. Even though the judge on that video conference, we were in court and my client was on video, was basically telling, and he was in the warden's office, I'm releasing him. He's finished the program. Well, we've got all these things. Obviously, the management system, the procedural system slows down in terms of when a judge makes an order and a release occurs. The same way that I'm seeing maybe the slowdown of when we in the General Assembly passed that budget amendment, allowing for this kind of safety valve to occur, and then we've not seen the results. And I hope everybody understands that while I think we could have done more, and Jen and I would certainly have advocated for more, we could not amend the governor's budget amendment to do more. So we were stuck with what was sent down from the governor's office. I believe I was a little more hopeful that we would see a lot more of those kind of releases in terms of, especially those that have a year or less in the nonviolent area. It seemed to be the easiest way that we could release some of the burden. And by reducing those numbers, we could have, in fact, allowed for some more social distancing and some more hygiene protocols to be in place in some ways that could have made our prison population safer. So I was for it. Some people gave me some funny looks for it, but I think it was the right thing to do. And again, I think we're going to have to address this issue later, maybe in the special session, maybe next session. But again, there's too many politicians out there, Republican and Democrat, that put on their brochure that they're tough on crime, that they voted for some bill or they put some bill in, and it's draconian and they don't see at 30,000 feet what the harm will be at the ground level. There were many of those then thought that any of this humanitarian effort with our prison population would be seen as being then weak on crime, or that they couldn't put that on a brochure. And unfortunately, politics sometimes removes the human element. And I think that's the danger. And it's not just a Republican problem, it's a Democrat problem, it's a reelection problem, it's a base problem, it's who I'm serving. We ought to serve humanity and not a particular group that supports you. And I hope that that's what drives us moving forward as we still continue to fight for common sense criminal justice reform here in the Commonwealth of Virginia.
Yeah, thank you, Senator Stanley. Thank you for kind of pulling the frame back a little bit. I actually wanted to do that with the next question. I'm going to direct this to Tram. So going from kind of this really granular release mechanisms for COVID specifically, turning again a broader lens and asking Tram, do you think that that COVID-19, the outbreaks that we've seen in jails and prisons, the public awareness of what you mentioned, that Virginia is a massive incarceration state, how many people are behind bars, the poor conditions, the deaths that we've seen, do you think that will be that can be a driver of broader criminal legal system reform going forward? And if you do, how do you envision that? You mentioned all the tools you use in your communications work, your strategic thinking. How do you envision that happening either in August or in January?
Absolutely. I mean, I think if anything, this COVID-19 crisis has essentially blown, the top off. It has revealed sort of all of the underpinnings of an unjust system, right? When people say that our system is broken, I sort of counter that by saying, actually, our system is working the way it was intended to, right? And so if we're going to really think about criminal justice, again, I think our work is to break down a system that has been working all too well and create a new system that actually puts people first, right? And this COVID crisis has blown the top off and revealed all of the inequities, especially around race. And we know that our incarceration system and mass incarceration has such a disproportionate impact on Black and brown people. And we need to be addressing that. And I think, we've seen now, at least here in Richmond, because that's where I live, like 19 days of straight protests. And the conversation has changed the dynamic so much, right? People are engaged and people are involved in a conversation that I think if we don't continue to organize and turn these protests into power, right, into a long-term engagement with the people, then we're missing a whole opportunity. And so it's on us right now to not only engage folks that are really paying attention right now in demonstrations, and I think we absolutely need to continue to do that. I think we also need to get people registered to vote and take that power to the polls, and then recognize that Election Day is never our finish line, right? It is a tool in our toolbox, but we need to be turning and harnessing that power into accountability after the fact. We talked a lot today about what we can do legislatively, whether in special session in August or in 2021. If we think about 2021, where I think is where most of the substantive bills will be introduced and debated and passed, right? Because August is a little rushed and it's a short special session. But we think about January 2021, that means after the elections in November, we have to be ready. We have to be ready to go and engage all of the folks who are activated, who turned out to vote because they want to change the system, because they want a new world, to engage them legislatively and to have conversations with folks like Senator Stanley and to be able to tell their stories, and so that our senators and our delegates can carry those stories with them as they debate and vote on such important pieces of legislation. So, as for our organization, we will continue to do that organizing work. It looks a little bit different now because of COVID, right? We can't do the door-to-door work that we're used to doing, but that doesn't mean that the conversations have stopped. We are engaging people and meeting them where they are. I'm not a technologically savvy person, but I swear to God, I have now over 9 apps on my phone because everybody uses something different, right? Whether it's Slack or WhatsApp or WeChat or, you know, whatever the hell it is, because we have to find the tools that reach the people where they are. And I think if we continue to engage them, communicate, and really paint and articulate the type of world and system that we are trying to create, people are ready. People are ready to roll up their sleeves and go. And this is really our opportunity to really pass meaningful and substantive reform.
Well, first, I definitely have so much empathy for your app overload. I think that is a universal phenomenon right now. But I so appreciate you bringing in the fact that, like, this legislative work, this policy work, it's not separate from movement and from the radical possibilities that are being created from what's happening in the street right now and the conversations that are occurring. So thank you very much for framing that way. And I'm gonna pose one final question to Mateo here, and then get to some of our coalition members' questions. So Mateo, I wanted to bring it back to COVID-19 pretty specifically here with the question to you. I know you, as you discussed earlier, you know, you've worked extensively with people held in both prisons and jails, and specifically actually doing work on solitary in VDOC. And as we heard from the men of Point, you know, the quarantine and segregation that's happening is actually not functionally that different from solitary sometimes. So I wondered if you could talk a bit about, you know, your direct interactions you've had with folks, or the COVID-19 hotline the ACLU of Virginia is operating. What are some of the most serious issues that people who are still behind bars right now are facing during the COVID pandemic? So we've talked about release mechanisms, but what do you think legislators and government officials can do to protect the people who are still in these facilities? What should they be doing during this pandemic, or what are you hearing that you'd like them to address?
I think, you know, from what we hear from people inside, you know, one of the biggest issues that some of the biggest issues that they have to deal with are, you know, the inability to socially distance. So, you know, the fact that they don't have access, they're given a single mask that they have to either wash, like in their cells. They're not really given or they have to send it out to be laundered. Lack of access to, you know, to disinfectants. One of the biggest things that's lacking also is just information. You know, information around what the prison's doing specifically on a given day. Constant rolling lockdowns that are, you know, preventing them from accessing from speaking to their families, speaking to advocates, speaking to attorneys. And also a lack of information and consistency around, you know, the early release program, processing issues. I think, you know, Senator Stanley, you know, had highlighted, you know, access to courts, you know, and access to judges, and the way that the VDOC handles those, and the way that local jails handle those as well. We hear a lot about inconsistent medical care. As far as, you know, the kind of solitary and isolation issues, I think a lot of the time, a lot of the instances where people are moved into isolation cells, it's a very ad hoc, kind of unrefined trend. There's no refined transfer into an isolation cell, but you know, it's done in such a way where they're stripped of, you know, what few privileges they even have, and also a lot of facilities aren't really designed to handle as many people in isolation. So you know, so there are a lot of conditions issues around that. You know, as far as the question of what legislators can do, you know, I think Senator McClellan hit it right on the head. It comes down to oversight, and it comes down to transparency and accountability. You know, particularly around, you know, we hear a lot about inconsistent policies and inconsistent treatment across different facilities, right? Like you'll have you'll have circumstances where, you know, things are kind of, you know, done completely by the book in one facility and done almost arbitrarily in another. You know, and that's that's a situation that, you know, I think a legislature can have, and oversight can have a lot of impact on. You know, and I think that, you know, one of the big issues, and I think that one of the things that, you know, kind of outside of just the, you know, the the kind of conditions inside is I think that, VDOT could also do a much better job in communicating with families and communicating information to loved ones of the people that are on the inside, because a lot of the time people can't get any kind of information about what's going on, about early release, or about even just what's going on in the facilities that where their loved ones are being held. There's a lot of things that need to be addressed, but I think that the biggest impact legislators can have is to provide some kind of mechanism of oversight so we can have some consistency across the system.
Thank you, Mateo. And that actually is the perfect segue. I don't know if that was intentional, to the first question that I'd like to invite a coalition member to ask. So Gay Gardner has a question actually about the specific source of the oversight, like who could provide that oversight. Gay, do you want to unmute yourself and ask the question yourself?
Sure. Yes, so I was glad to hear Senator McClellan's comments about the need for oversight of the VDOC. And, I'd like to hear ideas about the best way to accomplish that. The Board of Corrections used to have oversight authority over state prisons. That my understanding is that was taken away during the McClellan administration. I mean, the McDonnell administration. And, should that be restored? Would that be sufficient, or should there be a special inspector general, for example, just for the DOC? My organization, Interfaith Action for Human Rights, has tried to approach the IG for the Commonwealth to look into some of the things going on in the prisons. And we have not been successful in that. So there needs to be some other entity, obviously, to provide effective oversight.
So I'm going to open that up to any of the panelists who would like to respond.
Okay, and this is Bill Stanley, and just allow me to respond. So what I've learned over 11 years of being in the Senate, and especially in the General Assembly itself, is incrementalism is unfortunately the way that things progress. It took me 5 years. Amy Woolard and I worked 5-6 years on license suspension, which became SB1. We were a lone voice in the Valley for so long. But then all of a sudden, as we were persistent, we then gained traction, but then other people wanted to get involved and make changes and do this and that. My fear about oversight, and I think oversight is exactly what we need, and we need it with the DOC, because and a civilian oversight would be the proper way, and independent oversight. So when you get into the General Assembly, let's say that Jen McClellan and I propose a bill that would permit that kind of oversight. By the time you start in January with that bill to the time that you get to crossover, it's probably been amended, changed, and every stakeholder gets involved. And they either water it down, or the other thing that they try to do, which is to kill it with 1,000 cuts. And so I don't have the answer of what would be the solid oversight commission, what would be the makeup of that commission. I think you'd have to bring stakeholders from all across the Commonwealth of Virginia, and especially those that have an interest here on the panel, to be a part of not only the generation of that bill, but also to eventually sit on that oversight committee. Sometimes great intentions and great bills turn out to be horrible results. What looks great at 30,000 feet is horrible at the ground level. That's not to say I'm against this proposal. I'm for it. But if we're going to do something like that, then I guess the answer should be, then we know very solidly who's going to be as a part of that oversight, who will be on that panel, what their authority will be, and how it will be then executed before you go in, so that it's not subject to those 1,000 cuts. So it's not subject to so many changes in a watered down version, and something that people have to come together and agree on, or trade other legislation to make sure that this goes through, or this won't work for this person, so we're going to do it this way. Because eventually, I think if you're going to start with the premise of oversight and the strength of the oversight to make sure that we're taking care to treat every single person that's in the DOC with human kindness and humanity and justice that occurs even after their conviction, then we need to make sure that it is one of those rocks, a foundational rock that cannot be changed or shaken through the legislative process, because otherwise, sometimes, as you may have seen with all the bills I've done, whether it was weekend jail time that took 6 years for me to do and was so watered down so many times, I had to go back to the original bill 6 years later and just say, I'm not putting up with this anymore. This isn't something that with incrementalism that you can allow to occur over the next couple of years. If oversight is something that this is a process that you want, then we have to have decision-making that's going to be not only bipartisan, but not changed or shaken or changed by those stakeholders that may want to help, but ultimately may kill it, or those that want to kill it, but act like they're helping. So I'm all for, I think, the oversight that Senator McClellan talked about. It's just, if we're going to do that, then all of these people on this conversation right now need to get together and draw a consensus so that they have a rock solid proposal that will not be subject by the changing incrementalism or defeat in the General Assembly in the upcoming year.
Thank you, Senator Stanley. I'm going to pose one more question to the panel and just still encourage people to put their questions in the chat pod. We can share those with the panelists. We're actually compiling them in a Google Doc. So just because we don't get it today doesn't mean folks won't see it. So I'm going to invite Garnett to unmute if she is able to read her question. She wanted to address a specific question about a type of civil commitment that exists in Virginia's carceral system.
Can you hear me?
Yes.
Okay, good. I have earphones on. I wasn't sure. I'm going to read my question. I apologize in advance for that. I get nervous and I forget things. The most marginalized society, group in society is always the canary in the coal mine. People, because of the nature of their crime, who are given the label sex offender are in this society that group. Whatever the system is doing to these people will bleed into the rest of the carceral population. These most marginalized people are registered, tracked with GPS monitoring, and subject to the civil commitment, which imprisons them after they have served their time for their sentences. They are policed with something called the containment model. The containment model is a perversion of therapy for the purpose of law enforcement, operated through probation enforcement. This can be expanded to everyone else. And in other parts of the country, it is being expanded to other people who were formerly incarcerated. This is the system currently used in the Commonwealth of Virginia. If you were not familiar with it, you should be. It is literally the exact opposite of the model of community policing and restoration the defund the police movement is advancing. The carceral system in the Commonwealth every day, that the Commonwealth every day is practicing, is the exact opposite of what these values are. How is this going to be changed? And we at the Coalition and with Just Future Project would like to further this conversation with all the panelists.
So I'm going to open that up to any panelists who'd like to respond to Garnett's comments and her question. Or would like to commit to being in further conversation with the Just Futures Project about it.
Well, look, I'll step into this question, and certainly thank you for the question. I think, again, I come from the position as I was taught as a young man from my family, and certainly as I've grown in the 26 years of practice, that if you serve your debt to society, if you pay your debt to society, if you serve the time, even if, and I don't like anyone being branded with the scarlet letter of felony, but then we as a community, and if there are opportunities for that community, then help that person re-engage in society in a lawful and healthy way, then we should do everything we can to make that person a good part of this community, because then the justice system means nothing if someone commits crime, whatever that crime may be, serves their time, does it in a way that, that is required of them, and comes out, then we want to make sure that they're not branded with the scarlet letter of felony or branded with whatever kind of social, identification or social, a grouping that they may be, that you're a felon, you're a criminal, you're this, you're that. That there are many people that come out of prison, no matter what their charge was, and are then very productive members of this community. We have to be committed to that principle first and foremost. And if there are things that we can then structure around them to ensure, to assist and to help as they adjust coming back into the community, as they become a productive member, then we should also do that as well. As I tell my clients from all walks of life, from all charges that they may be faced with, that this may be a scary moment, but the door, if it swings closed, will always swing open. That when we leave here in this courtroom together, we leave a different person. We leave from from an instance with the criminal justice system that gives us hope. That does not brand us with the feeling that when we left there, well, they think I'm bad, so I'm just going to continue to be bad. I'm not going to be a part of the society. If we can embrace those simple principles, which were the foundations of a democrat society's judicial system, then I think every single person, no matter what they're charged with, no matter what the crime is, no matter how much time they serve, that if they do so and have paid their debts to society, that we treat them in a way that is not only human, but also embraces their return to the society in a way that will make them productive and that will continue to further reduce a very low recidivism rate that we have here in the Commonwealth.
Thank you, Senator Stanley, and thank you, Garnett, for the question. So these are obviously, it's just a huge topic and a critically important one, and we're not going to reach the end of it today, but we want to respect everyone's time. We're coming up on 7:30. So I do ask folks to stay with us for just 5 more minutes. I'm going to pass the mic back to Jen to share our coalition's call to action, because we never want to miss a good opportunity when we are all convened to think about how we can act collectively to move this work forward.
Thank you, Kim. So thank you all for this amazing discussion. It's been so lovely. For everybody who's here on the call, whether on Zoom or Facebook, first and foremost, this discussion has been amazing with Senator Stanley and Senator McClellan. And what we want to encourage you to do is to reach out to your own legislators and have these same discussions. It's a little different when you reach out personally, but reach out and ask them these questions and ask them what they're doing for people behind bars. Ask them what they're doing regarding COVID-19 for these populations that we care so much about, who are so impacted. Tell them that we want something to happen during the August reconvene, during a special session, that policing is important, but we want to be sure to include the other side of the coin, the prison reform and what's going on with prison population. So I'm going to stick in the chat in just a minute when I get done talking how you can find your legislators. So if you don't know, I'll stick a link in there so you can just put your address in and you can find them. And then also be sure, if you don't already, some of you are already on our Facebook, so I'm sure you're there. But if you're in the Zoom for some reason and you don't already follow us, I'll stick the link for the Facebook in one more time. And if for some reason you want to join the coalition and you're not already a member, you can reach out to us through Facebook or any other means. You can even put in the chat right now, because I'm going to save the chat and we'll have that information. You can stick your email address there and we'll have that information there. And you can also continue to reach out to the governor, to the Secretary of the Commonwealth, and the Secretary of Health and Public Safety, Brian Moran, and Kelly Thompson, and tell them that you want more done right now as far as COVID-19 and safety for people behind bars, and as far as expediting these early releases. So again, reach out to your legislators. I'll stick that link in there so you can figure out who they are if you don't know already. And please continue to follow us. We're going to have these town halls every other week going forward, and we've got some really exciting ones coming up. Commonwealth attorneys are next. We'll have some more different things going on after that, so please stay tuned and watch out for all of those.
Thank you, Jen. So I just want to give one final thank you, starting with the members of Point. Thank you so much for your words, for your letter, for Jen for lifting those up for us at the beginning. Thank you to our panel, our bipartisan legislators, Senator Stanley, Senator McClellan, and then to Mateo and Tram for joining us and providing kind of the movement and advocate perspective, which we know is so important to also moving this policy work forward. So, you know, for the 70,000 people, over 70,000 people who are behind bars in Virginia, who are disproportionately Black and brown, as we say in the streets, Black Lives Matter, and we must continue to transform our criminal legal system in Virginia, and both during this pandemic and beyond. So we invite you to join us in this work. Please take the actions that Jen listed out, and then we hope you'll stay in relationship with us because we've got work to do. We got to get our hands in the dirt. So thank you everyone for spending part of your evening with us. We really appreciate it. Thank you one last time to our panelists, and we hope to be working with each of you in the future.
Thank you for having me.
Thank you, everyone.
Thank you.